Hi.
Hello.
Hi.
How are you?
Can you hear me okay?
Mhm. Mhm.
How are you?
I'm well. I'm like, let me jump on. The time like went by so quick. I'm like, let me hurry up.
Yeah, it really did. It really did. I was
Let me
like,
hurry
"Oh my
up.
God." I was like, "Does he look like a decent human?"
I know. All right, let me put on a sweater. No, but thank you.
Yeah, absolutely. Thanks for inviting me. I
Absolutely.
was gonna ask, so is it just like us having a conversation or is it other people that join?
It's usually just us having a conversation and we record it and we play it back, but people are free to join. So sometimes we do have people join and they want to, jump in and ask questions and things like that.
Mhm.
But ultimately, I think it's just more like us just having a conversation. I hate to say interview, but
Well,
um,
yeah,
you know what
that's
I'm saying? Just kind of a
yeah.
absolutely, and then we just chop up the videos and play them back and stuff. So
Cool.
that's why I was like, make sure your lighting's good, make sure your
I know,
and
right?
it's good. It's perfect.
Let me look good.
Yeah. Um,
Did you get that picture in the background, with the girl with the crown from Society 6?
I just saw it on the internet. I don't know.
'Cause I have something, like, similar to that. There's an artist on this website. Do you know what Society 6 is?
No.
It's the I think you'd like it. So it's a cool website where artists can, like, upload their stuff, and then you could get it on, like, shower curtains, you could get it on
Probably, yeah, right? Okay.
yeah.
Society 6.
Mhm.
So I have this, like I do paint and sips and stuff. So I'm always looking, people always send me stuff. Can you paint this? Can you paint this? And this girl's like, I want this kind of for my office or whatever, but I want to paint it because it's probably from online. She saw it and she was like,
Yeah.
I don't want a digital picture. I want to paint it. And I was like, well, I'll do it. But then I painted it and I was like, well, I like it. So I'm gonna keep
I like it. That's why I thought that I mean, if you do stuff like that, the website lets you up like have it's almost like to me like Etsy, but just for like artistry and
artists. Okay. And
so
then you can just sell your stuff.
yeah, yeah.
People are like, you need to sell stuff. And I'm just like, I usually just take pictures, like people give me pictures and I just kind of simplify them. Cause I mean, I wouldn't really call myself an artist, but I'm okay. Like I can take
But I
something
mean,
and
that looks like something that I would have bought from that website from a particular artist. So that's why I was like, you should do it because it's tons of stuff
yeah.
on there. And I was like, you could like I said, people can buy it just in like the print form, or you could buy it like on a blanket, on a shower
Oh,
curtain.
any type of thing. I'm gonna have to look it up because I'm always like looking for stuff for my daughter too.
Yeah,
And
like pillow. Mhm.
yeah, I'm gonna have to look it up then, cause she's always like, "Oh, paint something," and I'm just like, I really just, I probably could just sketch something and paint it, but I usually just whatever somebody sends me, I'm like, okay, like this girl sent me like this picture of like the
Yeah,
hand somebody
I
smoking. That was for like a smoke and paint thing or whatever.
mhm.
And then some of the other ones, I just grabbed them offline. I was like, okay,
Yeah, I mean, that's a way
doing it soon.
for art, yeah, to put it out there.
Awesome. Let me see. I'm trying to look up. So, Nadia is actually one of the co-hosts. She's usually here, but I think she had something going on. And I
Yeah, for
think, and Heather, there's a few of us that kind of jump in and kind of host.
sure.
Um, and then we come up with questions. We're like, okay, these should be some great questions. And
Yeah,
then we send them to each other. So I'm just looking them up right now.
okay.
Okay, let me see. Queen Sunday questions. And really, I just have them, like I said, we may not necessarily go over all of them, but just having a
Yeah,
great.
I mean, I didn't write out, but I have stuff on hand to talk about. So it was nice that you even gave me questions, so that way it helps kind
Okay.
of like guide me and guide like the conversation and stuff. So yeah, I like it worked out for me.
Oh, I'll just wait one more minute just in case anybody wants to join.
No rush.
I'll be on it. But yeah. So yeah, we're still trying to figure out a flow. Like we want to do something, every week. Well, just allow people to come in. I am going to begin. I didn't want to test on you though. I was like, because there's like a configuration that you have to do the live streams on Facebook.
Mm-hmm.
And I'm just like, and it's very tedious to kind of integrate or interface all of them.
Do you pay for Zoom? Are
I
you?
do.
So it's called StreamYard. I don't
Okay.
know if you know what it is. I'm pretty sure that's the name of it. And when people are like doing those lives and stuff and they like change the background and like all that stuff,
Okay.
that's a good platform to do it on and not have to use them. So if you pay for one, that'll give you everything. Cause like you just do it on there and it'll stream live on like Facebook or IG. You could change the backgrounds, like
Oh.
yeah, and you could have people can comment on it, like
Okay.
monitor it all from that website. So you
Okay.
don't have to, how Zoom, like let's say you were doing it on Facebook, you would still have to have Zoom open and all this stuff.
Right. Right.
StreamYard just like streamlines the whole thing.
StreamYard. Boom.
Mhm.
Because I was like, I don't want to test it on her because I was testing it. I tested like a few times and then like it was all jacked up. I'm like, this configuration is too like tedious. Like I would want something like you just said, boom, boom,
Yeah,
boom, and it's okay. StreamYard.
yeah,
Because there's one called like Be Live or
Be
something.
Live, yeah, those things. And I think that with like Zoom, I think they're still getting kind of used to like having people use this platform so much that they're trying to add stuff and they haven't necessarily got it down, which is why it's probably so complicated for users to do that. But other places have. So StreamYard is just one of them, yeah.
Okay, okay. I'll definitely look it up tonight because I'm like, because we have so many pages and stuff, so we want to tie it in so that everybody can kind of see. And I'm like, this is gonna be such a great interview. Like people need to know, um, and so I definitely may have you back.
I'm excited.
Yeah, I'll have you back for sure because I want to circle back and have like the community know, like, especially, in that public health, arena, like this is for real. Like life is for real out here.
Life is real out
Life
here.
is real out here. So, we'll get into it, but um, definitely circle back when I have like the big audience where they can just come in because we want people to, chime in and ask questions, something like that. So yeah, for sure. Hey, Harmony Lenora.
Hi, my love. How are you?
Good, good. I'm sorry. Today has been so crazy.
That's okay. Same for me.
Yeah, okay. Because I'm like, we were supposed to touch base too. I'm like, oh,
Yeah.
a mess. Okay.
Hi,
So
Miss Olyvia.
Hi.
You're gorgeous. Hello.
Oh,
I know. She got
oh,
the
you
that
have
that.
look. You should have called me 15 minutes earlier. Now I called myself being like I was like I have to look decent. I need to find some light. I was like,
Because I had to put that disclaimer in there because people come on and like the room is dark and we could barely see them, and I'm like, you know what, I have to make sure this is a systematic thing. Like, all
and
right,
I
get
like that.
questions
I
out,
appreciate
make
it.
sure, yeah,
Yeah,
here's some,
that's
because some people are like, oh, I didn't really need questions, but just to,
I like the questions because I feel
okay,
like it helps guide the conversation, and I think it helps me with my responses and like kind of what you want
okay,
it to be, like what you want the conversation to be. So I think questions are a good thing, even if people don't like them. For you, like if you want like building your platform,
mhm,
still do questions for yourself.
mhm,
And people could take them or leave them, but I'm like it helps you too. You know what I'm saying? So I'm like,
okay,
yeah, I wouldn't cut that out if people don't take to them.
okay, cool, cool, cool.
Yeah.
Well, we'll get started. I'm gonna start the recording, and we'll go into the intros. So
Okay. Sounds good.
Harmony, it's just gonna be me because Heather and Nadia got caught up in some family stuff. So but feel free to jump in. Okay.
Okay.
Okay. um oh, it's automatically recording, so perfect. I changed the setting because I'm like, sometimes I forget.
Yeah.
All right, and we're back. Queen Sundays. We are here with the beautiful Olyvia
Oh.
Phillips to touch on some public health concerns. She's in it. She's in the trenches. Already has a podcast. Like, that's amazing. I'm just like, yes, we really need these type of platforms. So
Thank you. Thank
super excited that you have that going. But just give us a little intro about yourself.
Absolutely. So, hi, my name is Olyvia. I am currently an MPH MBA student. I am also a public health professional, and I work at a child health non-for-profit. And then I also just recently started a public health podcast called Public Health for the Culture, that talks about public health and trending topics. And that's a little bit about me. I'm pretty, I'm from Chicago, all
Yeah.
Chicago all day.
Okay. But what really made you want to get in public health? I feel like that's such a specific area. Was it?
Absolutely. So I have I'll take it back and then I'll go a little bit in the middle and
Okay.
then it'll all come together.
Okay.
So when I was younger, yeah, I was like, I gotta give kind of the little bit of the spiel, right?
Yeah.
So when I was younger, I had a chronic condition. I was diagnosed with chronic pancreatitis at like 5 years old, right?
Mm,
And for those who don't know, pancreatitis is generally found in adults who may have drinking issues or something like that. So it's generally from there. And kids, they don't know what causes it, but it's a very painful disease. And so I had that from basically, 5. So when I was born, essentially, up until like my teen years. And with that being said, when I was in my teen years and still going through it, I saw a lot of things. I was aware. I had to make sure I knew how to take care of myself if my parents weren't around or something like that. And with that being said, I was like, there's some messed up things happening. I remember one instance where it was the middle of the night. I was sleeping in the hospital, and next thing I know, I had to be transported to another hospital because
wow.
of insurance policy changes just in the middle of the night. And as
Wow.
a parent, you're frantic because you're like, how are you just going to uproot? But that's what they did. And
Yeah.
then I ended up back at the hospital the next day, the one that I was at. And it was a lot, right? And so for me, that kind of shaped my experiences in the healthcare system in general. So being a patient. And then on the other hand, I saw not just myself, but family members and friends having stress, anxiety, and like depression and things that we now have names for. But
Mm,
the things that people were going through, it was impacting their health. So
mm,
essentially, if you're looking for a job or something like that, and you have bills to pay and things like that, your blood pressure is up. You're
okay.
frantic, you're stressed out, whatever it is. And so that's what kind of prompted me. So
Okay.
moving forward, when I went to college, to be honest with you, I didn't know what public health was. When I talked about
I
wanting
was just gonna say, like, can you truly like just define it for the community, like for the audience? Like, what is public health really?
public health is literally looking at what other things impact people's lives outside of biological concerns, pretty much. So
Mm,
you look at the environment, you look at, access to healthcare, you look at all these other things, you create interventions and programming around them.
mm,
And when I was in school, now it's more prominent, but I didn't know what it was. When I talked about wanting to help people, it was kind of social work, right? So they were like,
right.
go into the social sciences.
Yeah.
And I just happened to be taking all these classes, psychology, sociology, and everything. And then health sciences came out, and that's public health. And I was like, oh, it just happened to work out.
Okay.
So if you want to be really intentional, public health is now more prominent, obviously. So
Right.
people who go to school or want to pursue a career in it in general, it's easier to kind of say and do.
Okay.
But yeah, I didn't exactly know what it was. I just knew what I wanted to do, and I just kind of fell into it. And I was like, well, this worked out. So that's a little bit.
Yeah, yeah. Because soon as I saw it, I was like, oh, because I'm a nurse, and so I'm like, oh,
Absolutely.
she definitely she's in the trenches,
Yeah,
um, and
yeah.
seeing that this pandemic is on the rise and flourishing, this ties in greatly with what's going on, and I wanted to get somebody who with this type of expertise to come on and kind of share. So. Well, what has it been like in the office, like with this whole COVID-19 happening? What has been the biggest initiative for your public health in the sector that you work?
Absolutely. So for me, I'm at a small child health nonprofit. I actually work at the Illinois chapter, American Academy of Pediatrics.
Okay.
And so I focus on child health in the realm of public health,
Okay.
which and to say this, like public health is a very big field.
Mhm.
It's
Mhm.
big. And so for me, I focus on child health from my personal experiences. That's just kind of where I went. And I'm fortunate enough to have already kind of been working from home. So the transition wasn't
Okay.
big. However, our priorities shifted, right?
Mhm.
So
Mhm.
if we're working on, I don't know, we work on immunizations work or policy, a lot of that work shifted to COVID. So now
Mm.
you're working on children, you're working on programming for to tell parents and caregivers that children still need to get well visits. It may
Okay.
happen via telemedicine, but it still has to happen. So the messaging kind of shifted, and kind of your pivot was to kind of be like, okay, COVID is impacting these communities. How
Mhm.
can we get policies happening? How
Mhm.
can we get programming happening?
Mhm.
What do we need to change in these grants? So working at the chapter, I work on state and local initiatives.
Okay.
So with that being said, it all shifted, right? What the state of Illinois needs and what children need to kind of get through this, what parents need to kind of get through.
Right.
So yeah, that's the pivot that I saw. It's really just kind of shifted everything to direct COVID because it hit very hard. So
Okay. And so you're saying that's pretty much in your sector, but even maybe even on the, like you said, in the state and local and even outside the pediatric, the movement has been, hey, y'all need to still make sure that you're
you're
taking
still
care of yourself and check it.
yeah, and especially being a nurse, you kind of know this. Like it helps if we can do the things at home that we have access to keep ourselves healthy.
Hmm.
Because people who need to go to the hospital or need to be in those spaces, they'll have access to what they need.
Right.
So that was really kind of what happened in my sector, and just in general. While I do focus on public, or I mean child health, you are on phone calls or you do get conversations about what's
Hmm.
happening as a whole as a
Right.
state.
Absolutely.
And Illinois, and I'll say Chicago specifically, we're very community. This pocket is here, this pocket is there. Like it's very segregated. It's a very
Okay.
segregated kind of pocketed
Okay.
city. And so, with that being said, the disparities, or the things that people were contending with already, so not having access to transportation
Hmm.
or healthcare, that was amplified, and it was amplified
Yeah.
everywhere.
Yeah.
So you have people in this part of the city who can't make it to the hospital over here. They don't have testing yet.
Hmm.
It was chaotic, and
Oh,
it
I
still is.
know.
I feel
I can
like
only imagine. I
yeah.
can only imagine. And I was gonna say, I know the numbers have been crazy, and you know what? Wow, that's just a loaded. That's just so loaded, right? Because, and like you said, like we already have the disparities within our communities, and then this hits us, right? And then all of a sudden, the social media kind of shifts and says, Black people be even more scared because you know
I
what are your
just
thoughts on that? I know that we already have health disparities among African American blacks, but do you feel like it was fear motivated? Do you feel like it's a true thing? Is it I mean, oh man, you can go so many
that's
different angles on
oh
that,
yeah,
but
right. We could do a series.
I know you can do a whole
I'll
season.
try to condense it. So I actually read an article from the Harvard Business Review site, and they had a line that stuck out to me. So it said, "When white America gets a cold, Black America gets pneumonia."
Oh,
That's exactly
oh,
yeah.
yes.
Yeah. So essentially, the Black community, there are already lots of things that are happening. There are already things that need to be addressed, especially with the racial injustices and things like that. That was already there, right? But
Hmm.
then when COVID happens, it kind of took the blanket off, and we're
Hmm.
already shivering a little bit, but it just took it completely off, and now
Right.
it's amplified. So you have communities who already have distrust of the medical system, and already going through that. So then when you add on COVID, it was like, what are we supposed to do?
Mhm.
What are we supposed
Mhm.
to do? Well, yeah, I feel like it was fear. It's also already having medical mistrust. It's already not having access to the things that you need to actually
Right.
live every day. And I
Right.
get like super frustrated because I'm like, if you don't have access to a grocery store now, how are you going to have access to one when you got to go out and get how are you going to survive when
Mhm.
you don't have it in your community? And then they're telling you, well, limit your time at the grocery store. I already couldn't
Right.
eat. So like,
Right. But Olivia, but like, should they be scared? You know what I'm saying? What is the messaging that you, being in the public health sector, like what has been the messaging that you guys want to put out to people to kind of bring them some type of comfort in this? You know, yes, we are a group that has huge disparities, health,
Yeah,
you know, everything. Like you said, now numbers are amplified. Now, you know, the numbers. So much so that people are like scared to like leave their houses and things like
yeah.
that. But should blacks be afraid?
Um, that and
And if not, what should they be truly be focusing on, you know, to move forward?
that question. So I guess just to clarify before I answer, do you mean afraid of COVID or do you mean afraid of the other pandemic, which is racism?
No, no, no.
Okay, those are two. We got a lot of pandemics at once.
The COVID
Okay,
specifically, you know what I mean? And just
okay,
because I feel like, you know, that was kind of on the, you know, on the front side of it, and then
yeah.
we could tie back in the back side of it, but
Yeah, okay. I was like, now look, we got a whole bunch of pandemics happening.
so
And
much going on in the world.
I was like, no, I gotta answer this. So for me, I wholeheartedly feel like you have you can have healthy fear.
Okay.
There's healthy fear. So
Okay.
here, meaning if you go out and make sure you're wearing your mask, make
Mhm.
sure you're staying safe, social distancing, following the guidelines. That's a good fear to have in terms of like being aware of what's happening,
Right.
but being overly, I guess, scared. I don't think so, but I know why that is. A lot of it plays into the media.
Mhm.
A lot of it is actually the media. I'll
Yeah.
say that.
Yeah.
So from my perspective and what I'm hearing about, a lot of the stuff that I work on is the messaging that needs to get out. And by the time, okay, for example, so by the time we, let's say, create a policy or something like that and it gets put out there, it literally has had so many different iterations that comes from CNN and all these things. So by the time it gets filtered to the people, it's like, what do I need to be concerned about? You know what I'm saying? So I think there's healthy fear, and I think that Black people, Black communities specifically, you don't have to be overly scared, but I think being aware is necessary, and I think just making sure to follow the basic of the basic guidelines.
Mhm.
And also, if you don't feel well, I do understand the mistrust of the medical system, especially with vaccines. That gets dated all the way back to the Tuskegee syphilis trials, just
Yes.
all these things. It really does. It really does. And so I think it's okay to have a healthy fear and be aware, but just know that if you do need medical help, you should
Yeah,
go get it.
absolutely.
So that's kind of where I'm at with that. It's
Yeah, no, and that makes sense, you know, and I think I'm pretty much on the lines of that. People are like, "You're not scared," and I'm just like, "Yeah, like I'm cautious, but I'm not fearful," you know, especially because there's as many deaths, there's 3 times as many people surviving. So I mean,
yeah, and
and
those
I
aren't
think
numbers that aren't reported either, right? So,
exactly, you know what I'm saying? It's like they're not reporting on the good stuff. They want to keep putting the fear about the
yeah.
bad stuff.
And part of
Um,
it, I do understand the still saying like people are ill and like you seeing those numbers, but I do think again the media plays a part because it needs to be a balance. It needs
mm,
to show people that there is hope, there is light on the other the other end of the tunnel. But I do understand that they have to show concerns because some people just won't listen at all. So it's just I don't know. It's all trash sometimes.
super trash.
It's all
It's super
trash.
trash, you know? And so, yeah, I totally get it. I totally
Yeah.
get it. But Harmony, feel free to jump in. You don't have to put it in the chat if you don't want to. But she had a question. But before I get to her question, you touched on something about the immunizations, right? And so there was this huge thing, like Bill Gates and his whole team and everybody in the world are coming up with this immunization. What is the messaging you want to put out about immunizations? I'm for some immunizations. I'm not an advocate for everything that they come up with immunization
Exactly.
for. You need to get. Um,
Exactly.
but as far as the COVID, you know, they're saying, oh, now they're gonna force everybody to have this immunization before we can go back into the real world, being, you know, going back to where we were in the world. Like, what is the messaging that you've been hearing? And
So for the COVID vaccine, I'll just be real. It's not probably going to happen for about 5 or 6 years. It's just not happening. It's
yeah,
not it as much as we hear. there's a rush to make a vaccine. What happens is you have a vaccine being created, then you got to go through the trials. You got to make, you got to go
Mhm.
through the different, you got to see how it impacts people. Then you got to do testing, and you just got to keep doing different iterations. And then by that time, the virus could mutate, and it could be a whole nother type of virus. So then they got to go back. And then let's say everybody or half the population gets it. Then you have to do herd immunity, and just it's
A
cyclical.
process. A
So it's a
process.
process. And I'm to be real, like, it's not happening for a while. Even if it comes out, it'll still be trial and error. It'll still be the pushback in general about the vaccine. Is it, going to help and things like that. And so just for immunizations in general, I'm with you. I'm very pro vaccine. I do think that we need to understand that certain vaccines that have come out, like polio and Tdap and
Mhm.
all those things, they prevent us from getting these diseases that have been eradicated. I'm
Right.
pro that. I don't want my child, or I don't want my mom, whoever, to have polio. I just
Mhm.
don't want like,
Mhm.
I
Mhm.
was like, we don't,
Period. Yeah.
so, and um for on the other hand, there are some that you can't, they are optional. So I think my messaging is get the ones that are strongly recommended and you need to get, and to make sure you remain healthy and safe, especially from ones um that can, eradicate. And then the other ones, do your research, but don't totally block it out.
Yep.
Because I can mention one that's still controversial, is the
Oh,
HPV vaccine.
okay.
When that was first introduced, and I feel like the early 2000s or so, like
Mhm.
that, it was basic. It was the sex vaccine, right? So it
Right.
was like, you get this, it prevents you from getting HPV. HPV happens from sex. Now the messaging has shifted, because that is an actual vaccine that prevents cancer.
Mm.
So, and that's what it is. So I think a lot of times too, it's all about messaging. It's all about how it's perceived. It's about, if you go to your provider, do you feel comfortable with what they recommend? Because
Mm.
providers have to, as a provider, if you're going to give a patient something, you have to feel that it's the best thing, or you have to be convicted, because your patient, if they see you, like not really feeling something, they're not going to want to get it, because they're like, I'm putting my health and trust in you.
Right.
So I think that that's something to consider. So again, just my messaging is get the ones that are needed and recommended, and keep you from having measles, because that ain't cute. And from there, do your research on the ones that are optional, but don't block them out of your mind, because they may
Absolutely.
be life-saving for you one day. So yeah.
Absolutely. And then, real quick, you had touched on, just speaking of vaccines and things like that. I know you had said that you primarily kind of work with the pediatric, in the pediatric area. There was a scare, like along with COVID, there was another kind of respiratory type of virus that was going around. Can you tell us a little bit more about that, or what's been kind of on the forefront of what's going on with that?
Yeah, so COVID essentially is a respiratory like so
Hmm.
the way that it's described is not necessarily what it actually is, from my understanding around the doctors that I am. Essentially, COVID is a disease. So the virus can lead to a disease that attacks all these other things, and it's mainly respiratory, right?
Hmm.
So people report having trouble breathing, and especially people who have asthma or other respiratory issues, it can really impact them, and that's what you want to prevent from getting to. So that's what I would say. It's basically one and the same, but it's always talked about as like separate things, and in
Okay.
reality, it's almost like the flu virus leads you to have all these symptoms,
Right.
and because it's called, that's essentially what it is, right? So
Okay.
the virus causes you to have this, and we don't need
Hmm.
you to get there, because especially if you have underlying medical conditions,
Issues.
it can
Yeah.
make it 20 times worse.
Okay.
So yeah, that's what it is. So it's not separate. And then in terms of for children, there's something I can't recall now, but for children, it's not necessarily as impacting unless they do have maybe chronic conditions or underlying things, but it still will be more respiratory and things like that. So
Okay.
um, it's not like two separate things. It's like together.
Okay. Because I was
Yeah.
just like,
Yeah.
especially my family, they're like, "Oh, it's the kids now," and I'm just like, "What?" And I totally, I'm a researcher. Like, I like to go in and just research stuff before I post it or share it or ask questions and stuff. And I'm just like, even then, even with the virus, I'm like, I want to understand,
How?
and for me, yeah, right. So, on the science side, I'm like, I want to understand, like, I understand viruses and how they work. And like, I'm even messaging the people like, the virus isn't going anywhere because you can't just
You
get rid
can't
of a
just
virus. Get rid of a virus.
just from a biology
from just
microbiology.
point blank, it's not going anywhere, people. It's not. And
Yeah.
so you can't walk in fear. And I think
Yeah.
that just ties in what Harmony was putting in the thing about, like, how that even sometimes that healthy fear can lead to anxiety, ridden homes, and people are placing even more and more stress about this virus, and they're just super concerned, like, I can't leave my house. And I have so many families like that, and I'm just like, you guys have to understand, like, I'm not leaving until they give me a vaccine. And I'm like, no, wait, don't do that, wait, come
But
back, calm
just
down, wait, I gotta understand. And like the mask, like, it's gonna, but no, well, that's not even the right mask, ma'am. Like,
right.
so it's
It's
not.
yeah.
But
It's
what about the mask stuff? Like, what are you guys? Because I know people are kind of like, I'm for it, but I'm not for it because it doesn't make sense, or
yeah.
you know.
So for the masking, especially for children, children over the age of 2 should wear a mask unless they have a chronic condition that prevents them. In which case you talk to the doctor about that. But with the mask, it's to cover. So I'll just be frank. A lot of this is very kind of disturbing to me, simply because I'm like, cover your mouth and maybe we wouldn't have these issues.
You-
Wash your
it was
hands.
common sense to me. Like, if you are 18 feet away from me, like, don't try to keep running away. Like, I'm
If
not even
you're
close to you,
stranger
ma'am.
danger,
Ma'am, I'm
right,
not even close to you.
exactly. If you're stranger danger, you probably shouldn't be this close to my face anyway, where your
Yes.
saliva could get on me.
Don't let
So,
somebody sneeze in your face, period.
right, learn these elements.
Basic.
I was like, why is all this bleach coming off the shelf? Don't y'all have bleach in y'all house? Like, it's just very, I was pressed. I was
What were
very,
you doing before, ma'am? What
I
were
was
you
like,
doing before? Like,
what?
y'all weren't washing your hands?
Exactly. I was like, it stresses me out.
Yes.
So in terms of the mask, I was like, it's literally just a precaution to make sure that your bodily fluids just stay away. You don't have to get the medical grade ones. Those should stay at the hospital, because
Hmm.
people are out here actually caring for patients, and not just COVID patients, but
Yes.
patients who are in there who maybe just had a recent surgery and they may have MRSA. So if you walk in the room, they have to
Yeah.
PPE. You have to
Yeah.
PPE up. So the mask coverings are really just to make sure that your bodily fluids stay with you.
Yes. Thank you.
And there's that. But it really at the root of COVID, it just stresses me out, because I
Yes.
was like, why don't y'all have some of these basic cleaning things in the house? Fabuloso, something, some baking soda and vinegar will do the trick. Some alcohol. I was like, why are we doing it? So it was really just a
What are we doing here? Yes.
I'm like, it freaked me out. It freaked me out on a germ standpoint.
Absolutely.
So yeah, that's how I feel about the mask, but that's just how I feel about it in general. I was like,
Oh my gosh. I'm like, it's not me. That's
it's
for you.
yeah,
That's
I
for
was like,
you.
I'm
Don't sneeze on
not
me. Like, you have a mask on. Like, even going to the grocery store, people are like, ooh, ooh. And I'm like,
exactly. I was like, you shouldn't have
yeah.
been doing that in the first place. I'm like, this is I don't understand. I don't
I try
understand.
to go when it's like as little as people as possible in these stores, because people are acting a fool. I'm like,
Early in the
I'm
morning
I'm
or
not gonna sneeze on you.
yeah,
Or
absolutely.
if you're sneezing, like, as I was going to the store, this guy was sneezing,
Mhm.
and this black lady like grabbed her husband, and she was like, oh, get back. And I'm just like, he has a mask on. It's okay. It's okay. But even then, like, why are you even coming into the store
Yeah,
hawking and, all that stuff?
right.
And it's like,
I was
you
like,
stay outside. It's okay, because he got
I
the
was like,
mask on and he's not
right.
even like by you, nowhere near you, ma'am. So it's okay.
That's funny.
And she
That's
was about to cuss him out. It was so funny. I'm like, okay.
okay.
But it's definitely crazy with the mask and stuff. So, and now that the world is kind of opening back up, how do you feel about kind of how do you feel about the world opening back up, period, right? So I understand that there's like the, the economic side. Our economy needs people. Like we need us out here making money, generating money and all that stuff in the economy. But on the other hand, like we aren't 100% safe yet, you know what I mean? And like we need people to stay home and stuff like that. So where are you on your thoughts of like the balance that needs to happen?
Well, first thing, we can't go back to normal for a variety of reasons, and whatever normal was, we can't do that.
Right.
We could talk about that when we maybe focus more on like the Black community and stuff like that.
Yeah.
But with the world opening up, it's not capitalism.
Mm-hmm.
I personally feel like the reason why it's opening back up is because some people at the higher up, their pockets may be getting a little low because
Mm-hmm.
people aren't, maybe we're spending a lot more maybe on Amazon or something, and Jeff Bezos is, he's collecting our coins. But other than that, it's capitalism because to me, I'm like, you sent out one stimulus check. For one, you knew that wasn't going to cover people's things. But if you really want to think about the health and well-being of people, people need money, people
Mm-hmm.
need housing, people need food.
Yep.
And I was like, what? You can't just give us this as a government. I was like, these are things for life. I was
Yes.
like, so if scientists, if Dr. Fauci or whoever is saying that, this virus is still out there and it can really impact people, all y'all got to do is be like, well, if you stay in the house, I'll just make sure your rent is canceled and paid.
Yes.
I'll make
Yes.
sure that, if you do get sick, you have access to this. So it's really capitalistic to me. And it infuriates me, especially from a public health standpoint, because I was like, hell, it's not my fault that these things happen, but it's up to, we have to listen to our government. And I'm like, y'all supposed to take care of us. I
Yeah.
didn't ask for COVID to come
Yeah.
here, but since it is, you know what people need to get through their lives. So why is
Yes.
it a conversation? Why are y'all bickering about a stimulus check when in reality you just wrote one in this month and it got quickly out, so you can
Right.
do it again and
You could do
again
it
until
again.
everything goes back to normal, because people took that money and basically put it back into the economy,
Done. I mean,
and
anyway.
our economy is still going. So
Mm-hmm.
I don't want to hear it. It was something that I read one time that really spoke to it when our government a lot of times talks about we're in debt. I was like, who do we owe? The Decepticons from
Yeah.
like Transformers? Who do we owe? I was like, create the money because it's
Create
going to
the
go
money. Yep.
and give it to the people. So it frustrates me because I was like, what people need, and if you really cared about the health and well-being, especially you're reporting about the COVID disproportionately impacting the Black community and all these things, what needs to be done
You
for
know.
people to have a good quality of life and be
Absolutely.
healthy. The
Right.
cost that people are, our government here in the US is willing to incur because of greed is ridiculous to me. People need respirators if they get really sick on this disease. That costs way more than you just giving people the basic
Mm-hmm.
access to care that they need, and maybe it wouldn't get to a respirator point.
Mm.
I really get frustrated.
You know what I'm saying? But speaking of that, right? So like this is supposed to be our government, the people that are supposed to kind of oversee the people, right? And take care of our basic needs and help us make sure we're doing all the stuff. Who do we trust, right? Like who are, even I'm just watching some of these like documentaries and different things like, okay, so you can't be trusted. And then you over here, okay, this organization can't be trusted. Who can we trust? In a time like this, what are some organizations and people that people can kind of tap into it to be like, okay, they're giving me the real honest truth about what's going on. These are real statistics. These are real, um, feedback on, what I should be doing next and things like that, or who?
So do you want like do you want like some resources people can contact, or do you just want my answer to that question?
Both, you know what I'm saying? Because, as professionals, we're like, okay, the who, and then these organizations are supposed to, but then even then we're seeing that numbers are being fabricated. We're seeing all these deceitful things that are happening behind the scenes. So just in your opinion,
In my opinion,
in your opinion, like who should people be going to find,
I
some answers?
that's a super hard question. To me, I just think, ooh, that's hard. So,
Right, because like you said, in one breath there is the research piece that we know,
yeah. But on
the
the other hand, people are struggling, like you said, with trust and the misinformation that we're already getting from organizations that we kind of just hold on a pedestal. Well, we have to because we don't have any other thing. So to me, there has to be, um, I guess you could say, when you look to the WHO or you look to the CDC or the Department of Health and Human Services, whatever it is that you look to, you just have to be conscious that you get the information, you process it. That's all you can do. And then you kind of go from there. You can't get sucked into
Yes.
it. And that's
Yes.
what I want to say. So in terms of, I guess, who can we trust? You have to take everything like with a grain of salt
Mm-hmm.
and then go from there. Like you can't get sucked into it. I think organizations for resources, however, I like specific like community organizations in general, like NAMI, the National Alliance of Mental Illness.
Okay.
They're really good because they talk about they work on mental health, but they also know that mental health, if you're having depression but you don't have a house, you're not concerned about going to a doctor right now or
Mm-hmm.
going to a therapist. You need housing, so they focus on that. Or
Okay.
or people, if they have their local housing, their housing what is it? Their housing department, but I forget what it's called. Like the housing authorities,
The
housing
authority.
authorities.
Mm-hmm.
Yeah. A lot of them are actually doing more programs that are community focused and
Okay.
not just resources for housing. Like people do need access to doctors and all this stuff. So, or like your local community center, stuff like that. Like you have
Yep.
to tap into the resources that are within your community. And
Yep.
especially, I want to emphasize that because a lot of times we don't know
Mm-hmm.
what's around us.
Mm-hmm.
So, like their public health departments, they have all types of stuff. And I barely knew that. And I was like, just continuing in this field, I was like, oh, y'all do this, y'all do
Right.
that,
And that's actually like
you
what I
know.
was gonna ask, kind of to tie in. I know we're coming up on time and stuff, but like, how does the Black community move forward, knowing that they have, the public health kind of organizations within their communities to lean on? Like, how should they be tapping into the public health organizations or even community organizations that are doing all these different type of initiatives to move forward? How do Black people move forward past this pandemic in regards to the health COVID-19?
Whew. A few things. I would say if you haven't already, really start to kind of how do you say, like, increase your health literacy.
Mm-hmm.
And by that I mean just be more conscious of what what's out there specifically for us, and kind of going, not being afraid to go on the CDC's website and look at
Yeah.
articles, or going on the American Medical Association. They have actually like a policy finder. So if you want to learn about policies that may impact you, or like disparities or something like that, in Illinois we have Health and Medicine Research Policy Group, and they have different programs that they look for volunteers on. And so you
Mm-hmm.
can find local organizations within your state or wherever it is, and they have all these resources, volunteer opportunities, and things like that that we can get involved in. And I think to not be scared to do that. I know I had that fear because
Mm-hmm.
I'm like, oh, maybe isn't the space for me, or oh, I don't have
Mm-hmm.
the knowledge. I'm not a doctor. Why am I here? I'm not a nurse. Why am I here? So I'm like, not like improving our health literacy, understanding terms and things like that. That I think those can really help, because then it'll keep you in the loop of what's going on.
Absolutely.
That's just a
And
few things. Yeah.
yeah, yeah, no, no, that's great. And I think that you hit it right on the head. If this kind of pandemic has not brought clarity to our the Black community, as far as like, we have huge disparities, we have huge, crutches that keep us from advancing, and health is a big one.
Mhm.
Um, but even then, do you think that people have kind of woken up to much have you seen numbers increase? Has in the public health, have you heard about numbers of like increasing of community people wanting to know more, being involved, tapping into resources? Or is there still kind of an ignorance kind of lingering within our community about the availability of resources to kind of help better their health?
I don't think I I've seen people, I've seen two things. I've seen people maybe wanting to get involved, but I also have just seen people being tired of
Mm.
being told to be involved
Mhm. Mhm.
or being tired of how do you say, being like, well, we have these resources here, but you don't feel comfortable in these spaces.
Mhm.
So that's what I've kind of seen. It's more so we're just kind of tired, like we're
Mhm.
tired. And I think that speaks to the whole racism thing too, is like we're just
Yeah.
tired of being told like, well, you can do this or you can do that, when in reality it's like a lot of systematic things, and it's a lot of
Yes.
things. You don't feel comfortable in these spaces. You
Yes.
still feel like you're going to be the only Black person in the room, so they're going to ask you about your experience. In
Yes.
reality, y'all are the gatekeepers of these things, so I need
Yes.
you to change.
Right.
I don't need change because I know my experience. So I think it's that, and I do want people to still feel empowered to get involved
Mhm.
in different levels of work, social work,
Yep.
public advocacy, whatever you want to call it. But
Yep.
I also need for the folks on the outside to be like, we're already here, so we need to change, you know?
Mhm.
And that's
Mhm.
what I kind of look at. And in terms of like, I just want to give you a few stats. Like for COVID, for example, there were 33% of hospitalized patients for COVID. They were all Black. 33% were Black.
Mhm.
But that made up just 18% of the community being evaluated. So I was like, how are we at 18%, but we're taking up 33? It's a lot of stats out here. And I
Right.
just want y'all to know that don't get too caught up in them,
Right.
but also do your research to understand them. But just know that things are impacting us, and it impacts us on a very heavy
Right.
scale. And I don't know,
It,
i'm
I'm tired.
I'm
I'm
like,
tad. Not
I'm like,
even tired. I'm
"Hi."
tad. I'm tad.
Yeah, because
But even then, like moving into that, just, lastly, you hit on the head about the policy changes, that need to happen. And I'm a huge person of like, people are processing, yeah, that's cute. You posting on your timeline and you're like, oh yeah, I'm out here, Black Lives Matter. But
yeah,
what are we doing on the back end? Like what are the true actions that people are gonna take? So just wondering, like, do you feel like policy change is going to be happening? Have you seen it happening even within your own organizations?
yeah.
Have they took a step back and be like, all right, let's revamp this, like let's do some reform here? And do you think that this revolution, because that's what's really truly happening right now, is going to be enough to see true policy change
Yeah.
in those systematic kind of
Yeah, I agree. So on the policy spectrum, I could give you a few that are actually out, and they've been even adapted more. So like the American Medical Association,
okay.
they have a policy on racial and ethnic disparities in healthcare. They also have a policy on the healthcare needs of the LGBTQ populations, which is very important because we have seen the killings of transgender women,
Mm-hmm.
especially in our community, and they're not getting really any platform to say that. So
Yeah.
there's policies within that. For the American Academy of Pediatrics, they put out their first policy on the impacts of racism on child and adolescent health. And so
Mm.
they're talking about how trauma essentially can really change your biology and shape how
Mm-hmm.
you grow up and your
Mm-hmm.
health outcomes, which I love that. It frustrates me that just happened, but I will
Yeah.
cry
It's like you just not figuring that out. You're just not figuring that
because I'm telling you,
out.
on a child spectrum, I don't know if you've heard of it, but it's called ACEs, and it's Adverse Childhood Experiences.
Mm-hmm.
It's a study that was done at Kaiser Permanente, I think it
Okay.
is. And essentially, the more ACEs that you got on this test, the more likely you were to have poor health outcomes when you grew up because of trauma.
Mm,
And it frustrates me because
absolutely.
just going back to my personal experience, I was like, I'm seeing all this stuff around me, so yeah, I'm gonna grow up and have
Yeah, I'm gonna grow up in trauma.
why
Yeah, I'm gonna grow up and be jacked up. What are you talking about?
and I was like, why is this a new thing? Why do doctors, you just want to say that I have high blood pressure, but you haven't asked me how my home
My
life
home life is.
or what's happening at
Yeah,
home?
the social determinants of health. Like you don't even know what, like you ain't even asking me if I even can I even get to a
Can I,
pharmacy?
can I even eat? You know,
Right, right. Basic things. Yeah,
yeah, the
absolutely.
CDC has a whole area. It's called Health in All Policies. It's a collaborative that they put together, and it integrates like health considerations into policy making for different groups of people. And so those are just a few policies, but if you want kind of to look more into policies, I would recommend going to like the AMA policy finder again, or looking on like the CDC, literally just type in like CDC policies, and you can find like finders and type in keywords to what you kind of want to look at. So I do think that we are seeing a shift in policies. I just don't necessarily like the slow uptake of it, but that's also very political.
Yep.
And so I think, yeah, I it's happening. It's just happening on a slower rate.
Yeah.
But I do think the more that we do get Black doctors, Black providers in general, and provider doesn't have to mean that you're a doctor. Provider doesn't have to necessarily mean that you're a nurse. Provider can mean that you're a community health worker, and you provide care to children who come into the community center, whatever it is. We have to get in those spaces.
Yep.
And so
Absolutely.
don't feel discouraged. Don't think that you just have to go this direct medicine and things like that. Like, we have to get in those spaces because we're kind of the ones who need to become the gatekeepers.
Yes, absolutely. More, leadership in our communities, the leaders. Yeah, absolutely. So Olivia, tell me a little bit more about your podcasts. What are some topics and things that you touch on? Where can people find it? Your social media.
Yeah, thanks. So my podcast again is Public Health for the Culture. You can find it on Spotify, Apple Podcasts, Stitcher, Google, wherever podcasts are found. That's where you can find it. I touch on a lot of topics. So some of the topics that I've talked about is education, COVID, and Black folks. And I've talked to a professor at Wayne State University. I've talked about the differences of misinformation and disinformation in health, because those are two different things. Maternal and child health, environmental health. I really try to focus on different topics and also tie them into things that are happening in the world. And I wanted it to be a space where like we could talk about health, but it's also pretty fun. I don't want it to be boring because I don't like it, because I was like, listening to certain talks or whatever, it can be super boring sometimes and like very one.
Yes.
So I wanted it to be informative, but also very entertaining.
Yeah.
And yes, so you can actually find me. The podcast is on, you can find it on Instagram, or I'm sorry, you can follow me on Instagram. It's The Real Public Health. That's on Instagram. And then on Twitter, it is Real Pub Health _ And then on Facebook, it's just The Real Public Health.
Awesome.
So yeah, those are my social medias. Thank you so much for
Absolutely.
talking.
And I am so serious. I want to circle back super soon, because I'm going to look into the resource you gave me for the streams, because we have a huge audience, with Black Dollar to Black Dollar, the She Before Me community, the She Before Me Facebook group, and even, our own community. So yes, I'm gonna, yes, because this is the type of conversations that people, they need to tap into and listen to and hear and understand. So I'll definitely be reaching out again. So I appreciate you, and I thank you. Thank you for being a leader and taking what you know and your passions about and putting it out there for the culture.
I'm trying. We need it. And that's really what inspired me in public health. I was like, okay, I gotta be okay with being the only Black girl in the room, but I'm gonna get some more of us in here. I have to get it in here. Yes. So thank you for having me. I appreciate this, and I look forward to talking with you guys in the future. Thank you so much.
Yay, thank you. Harmony.
Great job. Oh
I know you was over there shouting. I could just feel it. I could just feel it with all your comments.
Shondo.
You are so silly.
I tried.
She's so silly. I know you have a ton going on, so but I felt you.
I hope it was added.
I'm sorry, you said what?
No, I said I hope it was helpful. I hope I.
Oh yeah, for sure. That's what I said. Oh yeah, no. That's why I was like, we need to circle back on the live stream off of this, because this is good stuff. It's good stuff. Yes.
It could be a very long conversation. So I'm like,
I'm like, dang, the time running out already. Okay.
I know, but Thank you so much. Let me know when I could come back on with you guys.
Yes.
Like,
Awesome.
Awesome.
Awesome. We'll do. We'll do. Y'all have a good
Wonderful
night.
job.
have a
Good
good night.
night. Peace and
Bye, girl.
blessings.
Peace out.
Bye.